called as care of the newborn. Yesterday I discussed the maternity cycle. Next, after the delivery, you must be able to take care of a newborn baby. Why this is important? Because newborn means age group from 0 to 1 year. These are newborn period. In total world, if you consider, total world population is 1.2% of the newborn. 100% population is 100% population. Among that, 1.2% population is of newborn. Number one. Number two is the 50% of the infant mortality rate is seen in first 1 year. 90% of the infant mortality rate is seen in first week. That's why study of the newborn or care of newborn is very important. There is one terminology called as neonatology. What is neonatology? The study of a newborn. This is a science which deals with the study of a newborn. It's called as neonatology. And the doctor who takes care of a newborn is called as neonatologist. So, as soon as the baby is born, the aggressive newborn care has to be done. The word aggressive, remember, you cannot delay. So, aggressive care of a newborn has to be taken to get the newborn healthy baby. If you neglect the newborn, the complication will definitely occur, even if the normal delivery is there. So, early aggressive care of the newborn has to be taken, and this is classified under 3 headings: early newborn care, immediate newborn care, and late newborn care. So, early newborn care has to be taken because I told you maximum mortality rate occurs in first week. So, as soon as the baby is delivered, mother delivers the baby, as soon as the baby is exposed to the external atmosphere, baby is struggling for survival. So, the support to the baby has to be given in the form of 3 things. Number one is, as baby is exposed to the external environment where temperature may be low or high. As far as the baby is in the uterine cavity, baby is enjoying the life because there is a uterine cavity, there is a amniotic fluid, baby is getting the free oxygen, baby is getting the free nutrition and normal body temperature. Because whatever the temperature of the mother is there, baby enjoys everything at free of cost, and everybody is waiting for baby to come out. But as soon as the baby comes outside, when the baby is exposed to the external environment, what happens is the atmospheric temperature. First thing which affects the baby is temperature. And remember, more than 70% of the deaths of the baby occur because of hypothermia. Hypothermia means less temperature, low temperature. So baby care has to be taken in the form of cleaning the baby, in the form of wrapping with the cotton clothing. And again remember, as soon as the temperature I am telling you, the surface area of the head of the baby is larger than the surface area which has been given to the body, upper extremity, thorax, chest, and the upper and the lower extremity. So first you have to do, whatever you have to do is clean the face and cover the head first, because maximum heat loss from the body of the baby occurs from the head, as the surface area of the head is more as compared to the body of the baby. So clean the baby properly, remove the blood, mucous membrane, excessive vernix scratches, which is present on the external body of the baby, and cover it properly. Covering of the head is very important, just to prevent the temperature loss, just to prevent the hypothermia of the baby. Number one. Number two is, this baby takes the first breath when the baby comes outside. So in every pediatric hospital, the sentence is written. The sentence is, let me cry first today, let me cry at present, so that you can smile tomorrow. So let me cry today, baby says, let me cry today, so that you can smile tomorrow. So whenever the baby is exposed, first cover the baby. Second, as the baby takes the first breath, means baby is struggling for survival, give the support. Look for his respiration, whether the respiration is normal or not. If normal, just clean the baby, remove the mucus, vermis caseosa, blood, which is present on the external aspect of the body of the baby, and cover it properly. If the respiration is okay, if the color is pink, then no way. Third, you have to see is cardiac status. So cardiorespiratory status has to be seen. Means for that you have to auscultate the baby with the stethoscope, just to know the what is the cardiac status, normal heart sound or any murmurs like that. So this is the earliest newborn period. So you just look towards the baby, don't touch. First, see whatever the thing, external things which are present on the external aspect of the baby. This has to be done within few seconds. No more time has to be invested. So look the color, look for the reflexes, movements of the upper extremity and the lower extremity. Look for the respiration, and as the baby chest is very thin, even you can see the precordial pulsations at the fourth week. So, and see the maturity of the baby. Mature baby means baby is having the full grown nipples. Baby is having the full grown nipples. So from distance of 3 to 4 meters, you can see the nipples, you can see the respiration, you can see the respiration, you can see the precordial pulsations, you can see the reflexes of the baby. So all this can be visualized by inspecting the baby. So this is done in immediate care of the baby. There are many things, because there is a time now. There is a little bit time. Earliest we have to look for whatever I have told you. As there is a time, then see that whether respiration is okay or not. If the respiration is not okay, then do the oral suction of the baby with the help of the finger first. If lot of secretion there, you can use the suction machine with the suction catheter. If the respiration is not good, then give the oxygen. If still the baby is not improving, means you have to ventilate the baby with the face mask and the ambu bag. If the still baby is not responding, means you have to intubate the. Intubate means you pass the tracheal tube. Tracheal intubation has to be done, and give the artificial respiration or the ventilation with the ambu bag or with the ventilator. And baby's neck, face has to be turned to the one side, left side. Give head load so that whatever the secretions are present into the baby, they can be sucked out, or because of the gravity, the secretions come out the mouth, or by one side means they can come from the left side, wherever the you turn the baby. So this is number one. Number two is, there is a thing called as Apgar score. Apgar score. What is this Apgar score? In Apgar score, 5 things are seen. Five things. What are those? Number one is respiration. of the baby. Number 2 is color of the baby. Number 3 is reflexes of the baby. Number 4 is uh, movements of the upper extremity and the lower extremity. And number 5th is heart rate. Depending upon the Apgar score, you can label the baby as mild, severe depression, mild depression, and no depression. So respiration first. I will go in detail one by one. Respiration. So this score has to be counted at 0 minute as soon as the baby is born, at 1 minute, and at 2 minutes. So at 0 minute, what has to be there? If at 0 minute, if respiration is normal, color is pink, then heart sound are more than 100 per minute, reflexes are normal. What reflexes we see? Morose reflex. Morose reflex means just you catch the baby like this, baby will move the upper extremity and the lower extremity. That is morose reflex. So reflexes are normal. So color is normal, heart rate is normal, reflexes are normal. Then the muscle tone, if the baby is moving high upper extremity and lower extremity, normal movements, muscle tone is normal, and cry is normal. That means there is no respiration at 0 minute. So this has to be normal. If so, the baby is normal, no depression. Mild depression means color of the baby is, body is pink, upper extremity and lower extremities are blue. This is color. If the color is like this, in moderate, it is a moderate type. Then the respiration is less than 100. Reflexes are slow. Muscle power and tone is not normal. Baby is not moving the upper extremity and the lower extremity. Then this Apgar score is 4 to 7. Mild depression. In severe depression, what happens is absent or very minimal heart rate. Color is blue or pale. No muscle tone. No reflexes. No cry. That is severe depression. 0 to 3. 0 to 3 is a severe depression. 4 to 7 is a moderate depression. And more than 7 up to the 10, baby is not having depression. Baby is normal. So this has to be done immediately at 0 minute, 1 minute, and 2 minutes. And according to that, if some action has to be needed, the aggressive action has to be done. So this has to be seen. So Apgar score. First is give cardiac respiratory support. Second is temperature. Third is Apgar score. Fourth is care of the skin of the baby. As I told you, as soon as the baby is born, first look towards the baby. If pink, then normal with water and a soap, baby has to be lightly cleaned on the exit basket and cover the baby and keep properly. Just to avoid the temperature loss from the body of the baby. So this is called as care of the skin. Care of the eyes, as the baby is, if suppose there is a normal delivery, baby is coming out from the normal birth passage. If baby mother is suffering from some gonococcal infection, then baby eyes may get infected with a gonococcal infection called as gonococcal conjunctivitis. If severe infection is there, then ophthalmic neonatal means there is a lot of problem with the eyes. Baby may lose the vision. Just to prevent that, baby's eyes has to be cleaned with cotton and the normal saline. Just wet the cotton with the normal saline. Just wipe off the eyes like this lightly. And if the eyes are red, the nodule is there, start some antibiotic drops. So this is the care of the eye. Then the care of a cord, umbilical cord. As soon as the baby is delivered, if everything is fine, you can cut the umbilical cord by attaching the two artery forceps. So one on mother side and the other on the artery forceps on the baby side. And cut in between and tie it properly. So this cutting of the umbilical cord has to be done under strict aseptic precaution. Otherwise, baby will develop tetanus neonatal. So there are two things: tetanus neonatal and gonococcal related ophthalmic infection. These are the two infections which are commonly seen in the newborn. So care of the skin, care of the eyeball, eyes, care of the umbilical cord. This has to be done. And remember, temperature has to be maintained properly. About the feeding. The feeding of the baby has to be done. As soon as the baby is born, baby is given to the mother earliest possible, just to build a bond between the newborn baby and the mother. Earliest possible baby has to be given to the mother. So bonding becomes strong. Bonding becomes strong. And regarding the feeding of the baby, earliest possible feeding has to be started. Even if there is no milk, you just press the breast, you will get the drops of some breast milk. Earliest, that is called as colostrum. Colostrum. And this colostrum is very, very important. This colostrum contains proteins and anti-infectivity action. Colostrum gives three things. It gives nutrition, proteins, and has the anti-infective action. So even you must have heard the advertisement on TV or the radio. पहला घंटा बहुत जरूरी है. पहले घंटे में baby has to be fed. Breastfeed has to be started. Even if there is no breast milk, just press the nipple, you will get some colostrum which contains proteins, nutrition, and this has got anti-infective action. This has got anti-infective action. So this is of the breast milk. So this is all. Then we examine the baby properly in the late newborn care. So you have to examine for a presence of any congenital abnormalities like cleft lip, cleft palate, absence of ear, PDA, heart congenital abnormality, or presence or absence of the kidney under ultrasound, club foot, or deformity of the legs, joining of these fingers like this. So many deformities can be seen in the babies. So this has to be done in late stage. Another thing is you must look for the babies in late stage for two types of infection. Number one is gastroenteritis, diarrhea, and second is respiratory tract infection. These two things has to be examined. Infection of these two diseases has to be system, that is GI tract and the respiratory system, has to be carefully examined in the baby. Otherwise, baby will develop a lot of complications. So this is about the care of a newborn. This concludes this.